Hello, YouTubers. Joe Kersey here on Wednesday, October 16th at 2:30 in the afternoon Eastern Time. Now, yesterday I promised that I would tell some stories about various untoward events in OR hallways and perhaps in hospitals in general, in and around hospitals in general. Um, these all happened a long time ago, guys, and a number of the principals are dead. Um, I'll try to refrain from using names, but one or more of them may slip in there from time to time. Um, the first topic I wish to discuss is fistfights, fistfights in the OR. Now, when I was training at Ohio State uh, in anesthesia, uh, well, the fellow who's one of the principals of this story had since moved out to Children's Hospital, where I encountered him, when I was out there as part of my residency, both when I was out there as a surgery resident and as an anesthesia resident. And he's a heck of a good anesthesiologist, and but at one time before he went to medical school, after he got out of the Army, and this was probably after Korea, he was a semi-professional boxer, and then he went to medical school and became a physician, and then went into the then very nascent specialty of anesthesiology. So this would have taken place back in the mid 60s, mid 1960s. Now in the mid 1960s, they didn't have all the huge amounts of technology you've got back there on the anesthesia machine that you've got today. I mean, you might have had a long tube oscilloscope that looked like some sort of like a tube that you'd get like a map in, from UPS, and it would give you'd get one QRS complex on an EKG. And that was considered the height of technology at that point. Of course, you were taking blood pressure and you were presumably touching the patient and had some idea of what was going on and watching blood loss and so forth. But it was it was far more hands-on, and I'll tell you one of the problems with the modern technology is it's anesthesiology's lost that hands-on technology, hands-on. Toward the end of my, working life, I saw some of the younger guys, and by younger I mean younger than 39. They'd come in, and the only time they looked at the patient was to put the tube in. The rest of the time they'd be watching their machine. They wouldn't even necessarily squeeze the bag, let alone lay a hand on a pulse or anything. Well, anyway, this was another era. So, but which is prelude to one day this fellow was doing anesthesia or supervising anesthesia for either a nurse anesthetist was doing it or a resident was doing it, and he was in there supervising and making the rounds from room to room to room. You sort of ran a stable of these things, And that's still the case in some practices, unfortunately, but that's the way it is. That's the economics of the game. Anyways, he was working with this fellow who was well, this fellow was a general surgeon, and he had not yet become a transplant surgeon. Uh, and this this man was a very unpleasant man. This surgeon was a very unpleasant human being to deal with at the best of times. In fact, during his uh, last 2 years at the university there, before he went off to become chairman at another medical school, Department of Surgery at another medical school. He was not our chairman of surgery, but he was a professor, and then he went and became chairman at this other place. But even when I was a resident, a senior resident, my last year of anesthesia training, and then my brief stint as an assistant professor, I was the only one that would be willing to work with him. I was the only one that could get along with this guy. I can get along with there have only been about maybe 5 people in my professional life that I've not been able to get along with, and maybe the only 3 that I've absolutely not been able to get along with, maybe even just 2. And so anyway, this former semi-pro boxer was doing anesthesia essentially for this very unpleasant surgeon, and they got into an argument. I don't know. It could have been something about the case, like, oh, patient's not relaxed enough. That was always a favorite thing for the surgeons to whine about. In fact, the way to handle that is you say, sure, I'll give them some more stuff, and then just not give it. Actually, we had this bag full of succinylcholine, which we'd run as a drip, sometimes as a relaxant, and we'd put blue dye in it so that we wouldn't, accidentally hang it up and give it to somebody, it's IV fluid. And this one guy, this is not the same guy, but the surgeons, God bless surgeons, you gotta love them, and I do. I wanted to be one at one point. I still have that mentality. But they said, not relaxed enough, give them some more stuff. So we had this bag with blue dye, and so, we were running it as a drip, So what I would do after I had sort of realized, I knew that the guy didn't need any more of the drug, is we had a needle that we just sort of slid into the IV tubing on a little rubber bungee, and so I just pull that thing out and I just stick it into the mattress. Because the operating room table mattresses were sponge, They were covered with rubber and they're enclosed with sponge. So I just stick that thing in there and run it into the mattress. Then the guy'd look up and see the drip running away. He'd be very happy. Oh, relaxation's much better. Oh, I like working with Kersey. I'd say, good. Anyway, so these 2 fellows, the former boxer and this surgeon who thought he was the cock of the ecology walk, got into an argument, and the former boxer he got really mad. Now this guy had a very volatile temper. You did not want to cross this man. And he went over and he had one of these long tube oscilloscopes that I had told you about. He ripped it. It was on a pole attached to the side of the anesthesia machine. You had various brackets and things. He pulled this thing off the side of the anesthesia machine, and he, using it as a club, started to bludgeon this surgeon with this oscilloscope. Well, they took it out in the hallway to finish it. I don't think the oscilloscope featured in the finishing off up of this fight out in the hall. So the senior resident who was helping this, the senior surgical resident who was helping this surgeon on the case had to finish up the case, which is not in and of itself at all unusual. But that was always one of the classic stories. And along those same lines, when I was up in Fort Wayne for 15 months, there was a guy in my, I was in a group of I was the seventh man in a 7-man group. And one of my colleagues, who was, a big blocky guy who normally was one of the most gentle, pleasant, easygoing people I've ever met. He was doing a case. Well, he was doing one of these kind of local standby cases. Now, you've heard me talk about local standby cases before, but this was for a plastic surgeon, and he was doing the plastic surgeon was doing one of these breast stuffings. They put the prostheses in, and it was a purely cosmetic procedure, that's okay. But I think my colleague was somehow thinking that his time could have been better spent, although I don't know why. I mean, we're billing for it. We're all making a living. These things are all either insured or cash cases if they're doing cosmetic breast surgery. And the woman's lying there, and she's going, and of course she's in and out of it. She's going, "Oh, Dr. So-and-so," naming the surgeon. "Oh, you're making my breast so much beautiful." Woo. Yeah, and meanwhile, some sort of discussion got going on between my colleague and the surgeon, and it seems that the disagreement, became pretty intense. And so it seemed that the most effective measure or means of dispute resolution was to just go out in the hall and have a fist fight. Which they proceeded to do. And it was relatively short-lived, as most, actual fist fights are between grown men. And then they went back in and finished the case. I don't know who actually won the point in this very vigorous debate. See, that was in an era where you could sort of get away with some of this stuff. Now, I'll tell you one other story from Fort Wayne. There was the guy I went up to do, they wanted me to come up there. I was brought up to Fort Wayne after Ohio State sort of purged the kingdom there when they went into a different sort of practice plan payment arrangement. And the new chairman came in and cleaned house. To do this guy's open heart anesthesia, primarily his open heart anesthesia, and open heart anesthesia in general, but his in particular. Because we'd gotten along very well. He had been a year ahead of me in training, and actually about 3 years ahead of me in training. And so, I mean, we'd known each other a long time, and we got along very well. And which is important when you're doing that kind of stuff. And but there were two other guys in his surgical group, and one of them also did open heart surgery, and the other fellow was a general surgeon who did major vascular surgery, and he was one of the. He was one of the nicest guys in the world. You know, he was very kind to me, and I actually consulted him professionally at one point about a problem. And but this was in 1980. Well, during the run up to the 1980 election, you know, and Ted Kennedy was, well, of course, Ted Kennedy started running, you know, about a year or so ahead of that 1980 election, and so this happened actually in '79. But excuse me. So he's decided he's going to campaign in Fort Wayne, Indiana, and he's making a visit to this particular hospital. And of course, the Secret Service, you know, is there, you know, and so Ted Kennedy's in, you know. I guess he's giving a little talk in the auditorium. There's a news conference, and I don't know, maybe he's going up and, you know, glad handing people on the wards or something. But the surgeon that I'm telling you about, he had a case in another hospital, so he had to go, you know, drive. There were two other hospitals in Fort Wayne, and he had to go to one of them. And so he tries to go out the door to go to, you know, get in his car or Suburban and go to this other hospital. And the Secret Service won't let him. Secret Service won't let him out the ER. They won't let him out the door. Well, this guy was a big guy. I mean, he had huge hands. You know, you know. He would hold all the guts back when he was doing an aortic aneurysm. And hang on a minute. Sorry about that. He would hold all the guts back, you know, with one hand during an aortic aneurysm, and he would bang in the graft, you know, just with one hand. He was kind of like DeBakey. DeBakey would do that. DeBakey had huge hands. But DeBakey was a much smaller guy than this fellow, as I understand. Anyway, this guy's big. So he's accosted by these Secret Service agents. You know, you can't leave. Now, I have no idea why they wouldn't want you to leave. It wasn't like, you know, he wanted to go up and deal with Ted Kennedy. I can tell you that. I can tell you that right now. This man was not. He would be in no mood to deal with Ted Kennedy under the best of circumstances. And so he just shoves the Secret Service agent out of the way. And the Secret Service agent didn't do a dang thing about it. And he gets in his Suburban, and they had locked down the gates to the parking lot. He just drove the thing right through the gate. Good for him. Excellent. I'll tell you one more story about this, and then I'll save maybe a couple of these other stories for later. But sometime that year, there had been a one of these, and you hear about. Actually, this is not an uncommon situation, or wasn't at, you know, a certain point in our country's history, within my living memory. And there had been I guess a dispute over a pharmaceutical transaction out in the countryside that had resulted in somebody being shot. But not quite finished off. So this guy was up on, you know, our operating room was on the ground floor, and the ICU, for whatever bizarre reason, you know, it was on the second floor. So you always had to cram everybody in the elevator to get somebody up to the ICU. Anyway, so this guy's upstairs in the ICU, you know, on the second floor. So this guy comes, you know, the 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 the, the almost winner in this pharmaceutical transaction dispute comes into the hospital. Now, now, you know, he got into the hospital with a shotgun. You know, he didn't just, he didn't use one of these little 22, 25 caliber Saturday night special quote unquote guns. He came in with a shotgun. I assume it wasn't quite in plain sight. But he comes in with a shotgun. He goes up to the ICU, he goes and he blows this guy away right in bed. He finishes the job. Actually, I've heard that story. Well, similar stories from various hospitals. As I said, that's not all that unusual. When somebody comes in to finish the job. Well, okay, while we're up in Northeast Indiana, I'll tell you one more story. There was a very, 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 very large woman who was in the hospital for some reason. Now, I don't quite know what her underlying problem was. Maybe it was because she was a very, 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 very large woman. Well, anyway, she was in the hospital, and it seems that this woman had to go to the bathroom. Well, that does happen from time to time when you're in the hospital, doesn't it? So this was it's like one of these either 2 or 3 bed rooms, that had a common bathroom. You'd get out of the bed and you'd go to the bathroom and come back and get back in your bed. Or if you couldn't do it on your own, you'd call for help, and after several hours, somebody would come and help you. And or if it was one of these things where you have to use bedpan, they'd after several hours, I might come in and stick something on you. Although I will say that in general, the nursing at this hospital was fairly good nursing. So I'm being a bit sarcastic there. Anyway, this woman took it upon herself to somehow, I don't know how she shifted herself around, but she managed to shift herself around and get into the can. And it seems that after what was some sort of productive experience in there, I guess she was so overwhelmed, she fell off the can proper and wedged herself between the can and the wall. Now that's a heck of a feat, because there wasn't much room there, but she managed it. And she couldn't get out. And she also then proceeded to suffocate because she couldn't breathe. She was so fat. She was so wedged in. She couldn't move her chest or even her diaphragm because, so much weight was on it to ventilate adequately, and she died. She suffocated. Right there in the can in the hospital. With interestingly enough, 2 other people in the room with her. Well, I suppose it's not unusual to notice somebody, somebody goes in and they're not paying. The other 2 people obviously had their own problems. They were seriously ill. So eventually they did find her. They were a little bit more zealous about coming in and looking at patients at that hospital than that story I told you about, that time we walked in and found this guy stone cold dead, and the nurse had written down his normal vital signs not but a half hour before we arrived to make rounds. Look that one up if you haven't watched it. But so anyway, so they're faced with a dilemma. Here's this very large woman wedged into a room in a hospital room, wedged into a bathroom in a hospital room. And in order to get her out, they would have to cut a hole in the wall of this bathroom little enclosure. And also perhaps dismantle the toilet. It's one of these toilets that comes off the wall, you know. It's sort of cantilevered out. And, to get her out. Now these people didn't have insurance. Let's get to the heart of the problem. These people didn't have insurance. And so the hospital said, well, if we have to sort of cut down this room to get your loved one out, we're going to send you a bill. So the family went out in the hall and had a little consultation. And the consensus was that they didn't, grandma or mom's going to be in the ground anyway, so go ahead and do what you have to do. So I guess what had to be done was they got the fire department in there with a chainsaw and cut her out. Well, obviously, the bathroom needed a fairly thorough cleaning after that little exercise in cost saving, but that solved that problem and didn't destroy didn't destroy the hospital continued to use that room. They didn't have to close it down. There were no revenue losses. Family wasn't billed. I guess that's called a win-win nowadays, isn't it? So, well, I've got other things on my list, but I'm going to shut up now. Now, tonight, we're going to go over and have dinner with these good friends of ours across the road, and that'll be a nice little pleasant interlude. So, on that note, I'm going to say bye-bye now, YouTubers.